Good morning, everyone. First of all, I like this graphic and we used it for our pinning ceremony because I think it is a very good reflection of all the different entities that have to be working in communication and coordination with each other in order for us to adequately um, recover in this pandemic time. And I think that it also makes me feel good because I feel like we have that. Um, other than maybe tribal health and represented on our task force. And so that's encouraging that we have the pieces that we need in order to have an impact. On our campus, we are requiring a daily health check to enter the front gates from all faculty, staff, and students, as well as a TU checkpoint for any visitors that needs to be submitted prior to. But I wanted to present this today because this is actually a platform from the state of Alabama called God Safe, and actually any citizen in the state could actually download this to their phone and actually use this as a reporting system. It will be reported to the state of Alabama, and it also can report your status of positive or negative. And it is one of those systems that's on the Apple and Google platform, so that your phone pings, but you don't share personal information, but you'll know, and your phone will let you know if you've been around someone who's been exposed to COVID-19. Now, and I know the major concern that people have when we talk about sharing any kind of health information at the state level is in privacy. So I want to just take a moment to talk briefly about the Health Insurance Portability and Accountability Act of 1966, or HIPAA. That is the legal mandate that sets up the privacy rules and sets national standards for health information as to how who can gather it and how it's to be stored. It also sets a security rule about protecting health information that's held or transferred via electronic form. And the resource there to find out more about HIPAA and how it applies to this data is available, and we'll be happy to talk to you about what we're doing on campus to make sure we're staying HIPAA compliant through our laboratory, as well as our student health center. Macon County, as of this morning, is green, and Lee County as well. But as you can see, the surrounding counties are still yellow. So there are still some moderate risk out there that's surrounding us. And so I want to share this so that we continue to be vigilant as we venture outside of the county to conduct business or to visit. The percent positives that have been reported over the last week are demonstrated here. And I wanted to display this because there's been some conversation, at least in the healthcare committee, that the low risk is probably because they're not testing as much. And looking at this data, it shows that there has been a consistent decline over the last 2 weeks in the percent positives reflected for Macon County. And so we're down around 5%, which is very, very good. And is actually better than many states. And this is the number of tests that have actually been tested by week. And so as you can see, the testing has increased in over time and over the holidays. It has not decreased. So the thought or the indication that the percent positive or what's been reflected as low risk may be the result of not as much testing being conducted is not necessarily supported by the data that's available. So I think that green low risk is a true low risk. For the last 14 days, the actual number of cases that have been reflected in Macon County are listed here. And the trends, as you can see, usually the weekends, which is the 2021st, there's no reports that are going in, and then they go back to where the levels generally were prior to the weekend. And that's why you see those gaps in that days. At the university, we have started to report our COVID-19 dashboard. So for those people who are interested, this is on our COVID-19 microsite, but I want to share it here as well. We have tested over 309 students since the beginning of February. And of those, 304 are negative, 4 positive, and 1 was still pending as of the end of the week, ending February 20th. And for faculty and students, we tested 68 total faculty, 65 negative, 2 positive, and 1 was waiting. Again, this information is on the dashboard. There are currently 3 locations that are still testing locations in Macon County, with the university being one that caters specifically to the university faculty, staff, and long-term contractors. So part of what we talked a little bit about in our town hall meeting, I want to bring it back up here as we move into talking about vaccination, is that the goal from a public health perspective is to reach herd immunity with vaccinations. And we've done this with other similar types of communicable diseases in the past. And that is the push, and with the vaccinations currently, in hope that we will actually be able to limit the spread and also decrease the number of variants as it moves from person to person as we get more people inoculated. However, like the flu, with the many mutations with this vaccine, with this particular virus, it is anticipated that you will need to get continuous booster shots of the vaccination, even if it is impactful for months or years. But it's already in the science that it's probably not going to be a 1-dose type thing. So in Alabama, the number of doses that have been administered so far as of Friday, yesterday at 2:00 was 869,164. And of those, you can see it's been a pretty even distribution of Pfizer and Moderna, with Pfizer having a little bit more doses being administered in our state. And I think that's based purely on availability and the way it's been released from the federal stockpiles. Now, who has received at least 1 dose? Majority of the people that have received are between the age of 16 and 64. And again, the target population for the vaccine was healthcare providers and first responders first. And so that is reflective of that age group. The next largest age group is over 75. Again, that data falls along the guidelines of who could be vaccinated initially, then with the next highest group being 70 to 74. Of the persons who have received at least 1 inoculation, 60.8% of those individuals have been female, and 38.9% have been male. 54.4% have been Caucasian or white, and 12.8% have been Black, with a whopping 27.8% not reporting race. And I think that depends upon where you get the inoculation, whether or not they're actually doing the detailed reporting by race and ethnicity. So the locations you can get vaccinations in Macon County, if you so choose, are Primary Care Medical, Southeast Pediatrics, as well as they just added CVS and the Macon County Health Department as vaccine locations for the county. So there are 4 locations that are currently operational in Macon County for those persons who would like to be vaccinated. This information was gathered from the emergency use authorization, giving some data on the potential side effects based upon the clinical trials, with about 7% of the people in the 18 to 55% age range receiving the first dose of Pfizer. Fever was the most reported side effect. And with Moderna, you had about 17% reporting fever after they got their second dose. The most unreported side effect has been fatigue, as well as headaches and chill. And again, mostly after the second dose than the first dose with both vaccines. Significantly fewer recipients have reported diarrhea and vomiting as a result of the first and second shot, and people over the age of 55 receiving the Pfizer vaccine were less likely to report any of these side effects. Only 3% of older recipients, for example, reported fever after the first dose, with 21% reporting fever after the second dose. And from the EUA anaphylactic shock, which is what they should, when you get your vaccine, you should remain in a clinical setting for at least 15, 20 minutes to make sure that you don't have an allergic reaction. And that's why you're asked to wait, is because they're watching for this particular reaction, which could be deadly. So CDC is continuing to collect data along with what's been reported to the FDA. And there is and thank you, Sister Muhammad, for sending me that link. I have been watching that as well. There is BEARS, a system at CDC where when you get the vaccine, you are given access to actually input your own side effects and your any impacts that you feel like the vaccine has had on you. And from that, they're planning to report on these data points as this data starts to be reported and the rollout continues across the United States. The last thing I want to share is that mitigation is still very necessary. Even if you are fully vaccinated, and we've already had faculty and staff to ask this question, have received their vaccine course, you still have to mitigate and you still have to be tested if you're in the face-to-face environment, because if you read the language, it does not say that it will prevent you from getting COVID. And it does not say that you cannot still spread COVID. It actually indicates that you will not get severe illness or die. That is what the vaccines are mostly targeted to prevent. Because of the number of variants that are out there, we still have to mitigate and avoid large crowds and all the other mitigation strategies that we have. And I'll just end with another shameless plug about our COVID Aware program and the need to get as much information as possible about how we have African Americans adhere to, attend to, and adapt to health education and communication during pandemics, so that we can actually have a database that's fully reflective of the experience of our communities. So that's what we talked about in our most current meetings, and that's the information we continue to try to stay up to date on. I will, for our next presentation, go into VAERS. There has been deaths that have been reported throughout the clinical trial phase. There are up to over 700 deaths that have been reported and that are associated from people who've gotten the vaccination, but that it has not been determined definitively that it was the vaccination that they died from. Again, understanding that many of the vaccines were given in long-term care facilities where people had several other issues and could have already been in a state where they were headed down that path. So those are an investigation. I learn more about the system and read the details of the data. I'll be happy to report that at our later meetings. That's all I have. Thank you.